today's talk is something that's, I probably get more requests for this than just about anything. And not just addiction information, but secular counseling information. People that need, whether it's addiction counseling or mental health counseling, and looking for one that's not Christian-based can sometimes be a challenge. Megan is, she's a physician, and this is Dr. Megan Way here in front. She's a physician. She's a board-certified anesthesiologist practicing here in the DFW area since 2008. She started her career in academics at UT Southwestern, going into private practice in 2012. She received her master's degree in healthcare administration in 2013 and has served as the chief of anesthesia at several facilities with a focus on pain management and patient safety. Over this past year, she's shifted gears and is pursuing her new passion, is currently working toward her board certification in addiction medicine. She'll be serving as the medical director of a new outpatient addiction treatment center in DeSoto called Clean Slate, and that begins for her in December. So Megan's going to come up and talk about that. She's going to share some of her personal story. On a side note, Megan is her and her family, her husband Jeremy and their children are beloved community members, and many of us here count them, her and her husband, amongst our closest friends. It was hard to watch what was going on in her life, but it's been fun to watch her pick those pieces up and do so well with it, and so I'm looking forward to hearing her sharing her story with you. To share a little peace of mind, I went through NA, Narcotics Anonymous, back, I don't know, it was maybe 35 years ago. It was a long, long time ago. And I was young, I was like 18. And I got hung up on one of the first couple of steps where they go into the higher power thing, right? And I simply could not get over it. And I remember the guy that was running things said, well, he finally decided, after arguing with me, that I needed to select a tree as my higher power. And I was supposed to hand off all my problems to a tree, And the thing was court mandated, so I gave all my problems to a tree. But the whole thing is ridiculous. The larger point being is that if you are a non-believer, it can be tough to get through some of the programs that are out there. So I'm looking forward to hear what Megan has to say about it, and look forward, there'll be some opportunity for you to have some discussion and ask some questions afterwards. So ladies and gentlemen, Dr. Megan Way.
That poor tree.
All right.
Good morning. So please forgive me, but it has been a long time since I've, gotten up in front of people and talked, and certainly not about something, that has been so personal for me. Let me see. So this is a really tough topic, addiction and recovery, specifically because it's often so personal for each of us. I think everybody knows how much of a problem addiction is in our country, but just in case you missed it, drugs now kill more people than cars, than guns. Roughly 78 people a day die. And it's estimated that 20 million Americans have a current substance use disorder. So if you factor in, not just the people with the actual substance use disorder, but all of the family and loved ones, and friends that are affected, I mean, that's just a huge number of people that are affected. And the results can be devastating. So I'm going to ask for some latitude. I'm going to try to cover, as much of this really broad topic as I can in, as non-judgmental way as possible. I'm going to share some of my own personal experiences and try to tie some of that in. But obviously, when we have 30 minutes is not going to be a sufficient amount of time to cover everything. Okay, so let's see here. All right, so this is basically what we're going to try to talk about. I'm going to try to hit some of the highlights and just give, some broad overviews, and then specifically tie in like our current understanding of what we know about addiction and how that affects treatment. And then we're going to talk about some of the, more specific secular issues that I think probably a lot of people, it's the reason that you came out today. And then, of course, I'll try not to get too much onto my soapbox, but from a political and socio, economic kind of standpoint, there's a lot that we can do better. So we'll talk about that at the end as well. So I put up this picture because, that's my family. And there's some discord, I think, when people, see me or, see pictures like this. I'm going to just be pretty frank about what happened, but I am a recovering drug addict. And I will never forget going into a treatment center. I was malnourished, I was cachectic and wasted and anemic, and I was severely ill, and I was an emotional wreck. And, I go in to meet the therapist, and it's this very well-dressed but kind of grizzled, gnarly old man. He kind of looks at me and he says, "So what brings a nice young lady like you into a place like this?" And that's the question, right? I mean, by all accounts, I'm a very normal, well-off person, have a great career and, beautiful children and all of these things going for my life. And yet somehow I ended up as, a drug addict who, could barely function. I mean, it was so bad. So, that's the question that, every addict and their family and their loved ones face is, how in the hell did this happen? That story, I'll bring up little pieces of it as we go through. Okay. So back to the beginning. Drugs have been around for a really long time. Since basically recorded history. Mind, body, and mood-altering substances. And our understanding of the use and the value of these substances has obviously changed significantly throughout time, and is influenced by both culture and, all of the things that tell us when to use these, when these can be appropriate for use. So if you're, in a culture like the American Indians, mind-altering substances have their own specific and unique purpose versus, other cultures where they're more for relaxation or all sorts of different reasons. Historically, though, imbibing has generally been socially acceptable. It's a great way to pass the time when you didn't have anything else to do. But typically, intoxication or inebriation has been frowned upon. And in our society particularly, it's often been sort of demonized. And that has played a big part in how we view addiction. But in the past, we didn't often see the level of addiction that we do now because of access. So, you had alcohol and you had opium, but we certainly didn't have fentanyl or methamphetamines or propofol. So that played a big part in why we're seeing it as such a problem now. So, throughout history, there's been lots of different viewpoints and understanding of addiction. In the past, like in the 1800s, it was basically the moral, temperance, and criminal models. So it was just basically believed to be, either a lack of willpower, deviant behavior, or even just criminal behavior. People who couldn't handle their liquor or, used substances to excess, It was just an aberration. And we would take those people, depending on your affluence, your, the resources that you had available. You were either, quietly taken care of by your family, or you were locked up in an asylum and just, tossed away. There really wasn't a whole lot of things that we did for these people other than that. But basically, as the industrial age came upon, those family and social ties were weakened. And so, people were more and more developing addiction, and we had less ways to control it. And this is about the time that the disease models started popping up. So people are kind of going, okay, maybe there's something else going on here. And right around the time of the end of Prohibition is when these disease models started popping up. And they still, continue today. And a lot of our understanding about the biology of addiction and substance use comes from that. There is a really great book by Johann Hari called Chasing the Scream, that if anybody's interested in, reviewing kind of the past 100 years, of how our society has, how all these, forces have interplayed in the way that we view addiction and drug use. That's a great book. He has some TED Talks too that are really good. All right. So, basically what we understand now is that addiction is a spectrum disorder. Medically speaking, it's true that you can't become an addict if you never use drugs. And so that often becomes, the tagline is just don't do it. But as we've seen from, recorded history, drugs are here. They're not going anywhere. People are going to use them. We try to look at things, in phases of use, basically. So while it's true that you can't become an addict if you don't use drugs, then the opposite is not true, though. Not everyone who uses drugs becomes an addict. So for most people, I wish I had like a little pointer, but for most people, we use drugs, and either socially, recreationally, or even sometimes into the more moderate use. But we never move on into that chronic, compulsive, or chaotic phase where we start to see addiction develop. Oh, thanks. And so our understanding of why this develops and in who it develops has grown significantly. Okay, I don't know how. Yeah. Never mind. But basically, so the key I want people to take away from this is that there's a difference between substance use or misuse and addiction. Okay, so oftentimes, especially with young people, there's some experimentation that happens, or we want to try it, out and see what it's like. That is not addiction, okay? And it does not need the level of treatment, that someone with an addiction issue has. This is also where a lot of the confusion comes up with, people who are like, oh yeah, I was addicted to blank, fill in the blank, methamphetamines or whatever, but I just stopped. And it was fine. It kind of sucked for a couple of days, and then I went on about my business. That is not addiction, okay? If you can just stop and go on with your life, then you don't have an addiction issue. You may have had, a substance abuse issue or a misuse issue, and it got kind of out of hand, and you started feeling some of the biological effects of it. But, that's different than what we see with people who can't stop. And it's on the next slide. It's regardless of harm. Yeah. So continued use despite harm. And now we know, I'll go over this a little bit later, but there's a lot of different factors that go into the development and the treatment of addiction. But the hallmark is loss of control. So with addiction, people lose control of their substance use, and then they lose control of their lives due to that substance abuse. Okay? And this is the key difference. And this is where, we get into that confusion area because, like I said, some people, you can still have some of the effects of drug use or abuse without having actual addiction. Okay. So, the favored model today, I'm kind of jumping around, but the favored model today is basically incorporates a lot of the old models. So we have the, disease model, and we have these psychological models, even some of the temperance, models. But it basically, everything that we've learned has been shoved into this one model, and it's the biopsychosocial spiritual model. So it basically breaks things down into 4 categories. And they apply this to a lot of different diseases. But I think it's specifically helpful for addiction because it helps us understand, where we need to look for an individual's risk factors, susceptibilities, causes, and then, of course, how we treat them. So the biological is just, the physical way that we work. Psychological is how we think and act. Social is how we interact and bond. And then spiritual is the beliefs and values and how we find meaning and purpose. This is going to be a fun topic. I'll start with the easy one for us, and that's the biological. So back in the day, we all saw those awesome commercials where, they'd crack an egg and this is your brain on drugs. And, there's some truth there. There's definitely some truth there, okay? The problem is that that's not the whole truth. It's not, a clear picture. So biologically, we do know that drugs affect your brain. And they actually cause some pretty serious, changes in your brain. The great thing is that most of the time, these are not permanent changes. However, the biological parts contribute to the overall development of addiction. So basically, your, things that are sort of innate in us to ensure our survival get hijacked by drugs. So the systems that, reward us for things like sex and food that keep us alive get hijacked and actually create this really powerful desire to continue to use these drugs, even while they're also doing damage. So it creates, and the damage that that's being done is being done so in places like your prefrontal cortex, which affect your decision making. So now, whereas you might have been, able to say, gosh, I don't think I ought to use drugs at this point. That'd probably not be a great idea. Your decision making has become impaired, and it now becomes more likely that you'll think that's okay. It also affects, areas of our brain like the amygdala and the, oh gosh, we'll just go with the amygdala. There's another part of your brain that affects emotions, but it basically takes over your emotional state. And so you develop more impulsivity and compulsivity in using your drugs of choice. It affects your, hypothalamic tracts, which allow proper stress regulation and homeostasis, and increase your, desire for these drugs. So basically, it becomes kind of a vicious cycle. It also, and this is something that I was talking with, someone before. It also actually causes syndromes similar to depression, anxiety, bipolar disorder, personality disorders, and so oftentimes, we'll see people who have had long-term addiction issues look like they have these syndromes, like major depressive disorder or anxiety disorder, and they're actually just drug-induced disorders. But this also, lends to that cycle. So the treatment modalities in this area basically focus on removing the substance. by removing the substance, your brain starts to heal. And it usually takes about 1 month of sobriety for every year that you use to return to a normal state. The unfortunate part is that once these pathways are developed, you basically can fairly easily revert back into those pathways. So even though your brain has healed and may not be using those pathways like it once did, they're still there. And so that's what's led to this idea that it's a chronic progressive disease, because once those pathways are laid, it's really easy to revert back into the chronic use, even with just after one use, which is kind of strange. So new therapies in this area are basically, designed to try to help addicts get their brain back into homeostasis, and also to minimize withdrawal and cravings. So we have a lot of drugs that are being used, like naltrexone, gabapentin, ketamine, and there's, also a lot of newer treatments that are being used. One of the ones that I just read about was this electromagnetic wave treatment, which is actually, it sounds kind of, woo-woo, but apparently it has some good data behind it. So there's a lot of, research and study going on trying to target this part of addiction, the biological causes, because it can be pretty significant. For most drugs and substance abuse, removing the substance allows brain healing. And after a certain amount of time, people are able to maintain sobriety. There's a caveat to that, and we'll talk about this at the end, but it's opioid-induced or opioid addiction. And so that presents a problem in itself that we'll just talk about here in a minute. So this is just a little fun fact. I'm going to skip that because I'm going to run out of time. So the other part, and this is the keys, the psychological factors. In 1978, there was a guy who did some experiments who was basically contesting the biological or disease models. And he said that there's got to be something more. So in the past, they'd use these rat models, they'd put them in this box and they'd, isolate them and give them access to all these sorts of drugs. And basically every rat that they experimented on would just use drugs until they die. That's it. Gave up everything else. And what this guy did was put these rats in they called it rat park. So he gave them, some social interaction and little wheels to play with. And he actually found that those rats didn't develop addiction issues. They were offered the same, highly addictive drugs, and they chose not to do them. They actually continued to, eat and play and have sex and do all sorts of other stuff. And so that, starting in the late 70s really flipped our understanding of addiction and has, led us into the kind of current treatments that we see today that we are more familiar with. So sociological stuff, this is kind of a subset of the psychological, but basically, we've found that, larger groups do affect, how we, our susceptibility to addiction, and then how effective treatment programs can be. I didn't realize, man, this has gone fast. So this is the one that gets most of us. And this is where, when we start talking about, treatment issues, that dreaded S word, the spirituality part. But I really hate that, religion has kind of tried to co-opt this because it has nothing to do with God. It doesn't have to. For some people, obviously it does, but it doesn't have to. And, in its broadest sense, this is how we develop meaning and purpose in our life. Okay, so that can come from anything, which is great news for people who are trying to recover from, an addiction, if that is part of the cause for you. It certainly was for me. I kind of went through that like midlife crisis. And so, that contributed to, me developing this addiction. And so this was a big part of my treatment, was trying to, redefine what I wanted my life to be like, why I would want it that way. So what were my values? What was my purpose and, for being here? And for, initially for a time it was, I just want to get high. I would rather die if I can't use drugs. And, saying that out loud, it's like, wow, that's horrible. So, looking at these things and really, getting to talk through them, it allows a certain level of healing, I think, that I don't like just having, religious people have access to. I don't want secular people to have to ignore this part of it. It's a huge piece. All right. So best treatment programs. Everyone knows there's a gazillion of them right now. And, everyone has a different idea and, about what's best, what we should use, do this, do that, what the causes are, blah, blah, blah. Basically, what we found is that the best treatment is the one that's effective for that individual. So that's going to look different for everyone. I'm just going to kind of skip ahead, but, one of the problems is that, back in the 1930s, this 12-step program called AA was developed by a couple of guys. And at the time, it was revolutionary. It was great because, remember, it's being compared to asylums, okay? That's all you had. You had AA or the asylum. So at the time, it was fantastic. The problem with it is that it's not run by professionals. It's a bunch of addicts, which, God bless you, don't necessarily always know what they're doing. And so it developed kind of a cult-like following. Which surprisingly is still, heavily enforced today. I'm required to go to a 12-step program as part of my recovery to maintain my medical license, which is surprising because you would think that with the information that we have today, especially for physicians, they would recognize that that is one of many ways to recover from addiction. But basically, the most effective treatment programs are ones that try to treat all 4 different components of that model that we talked about. So it is important to look at the biological factors. There are certain drugs that do have more of a hook, that have that are more difficult to come off of, and that specifically one is opioids. So things like morphine, pain pills, heroin, all of those. Basically, when you try the abstinence-only approach for the biological, these people relapse. It fails miserably. There's something different about that specific addiction. And so all of the evidence that we have so far says that medication-assisted treatment is better for them. And this is actually what I'm going to be doing in the treatment center, is offering medication to help people recover. And this is where a lot of times people get confused. It's like, if I'm taking an opioid, a long-acting, steady-state opioid, am I recovering? Certainly not sober as we kind of think about it. But these people do better. They're able to get their lives back. They are no longer, having all of the consequences and the negative side effects, and they're able to function. So, it can be, this is, one of those debatable topics. But the evidence right now supports the use of medication-assisted treatment for opioid disorders, and they're finding that it may actually be true for alcohol and benzodiazepines as well. So, but some of the other keys is, I would recommend obviously being treated by professionals, or at least have some oversight by a professional, either a therapist or, an addiction medicine psychiatrist or specialist, just because there's a lot of scams going on. And unfortunately, the people, there's a lot of money to be made. So people with insurance and, all these new, crazy treatments, there's always somebody there to offer you those treatments and take your money. And there's absolutely no oversight into the effectiveness of some of these things. Man, so we're going to run out of time. All right, so we're going to skip ahead to... Oh, okay, cool. I was like, yeah, we're gonna, I just want to make sure that I have time because I know a lot of people probably have questions or things that they want to talk about. So we talked a little bit about, the role of these 12-step programs and how, and especially in Texas and kind of along the Bible Belt, this is the main, treatment modality that's offered to people. And it works for some people. It works wonderfully. The problem is that it doesn't work for everybody. And there's a growing number of people whom, try this method of recovery and fail miserably, either through, continuous relapsing or just, they can't seem to stick with it. So for us, there's a lot of different programs, but they're not as highly publicized. One of the ones that I found was Smart Recovery. It basically is, it's a secular version of, the 12 steps. They don't have all of the higher power stuff, but it does go through, some of the psychology and has the same identification of why you're using it. So on one of the previous slides, the big thing people have to recognize is why you're using it. It's a maladaptive coping mechanism. And so for me, it was initially, discomfort plus your chemical equals comfort. And you can sub in whatever it is. So anxiety plus my chemical equals relaxation. Boring plus my chemical equals fun. And so this, changes and it's different for everyone, but it's important to recognize like what that is for each individual. The other thing is that, people have to want to change. So if I'm not having any sort of consequences or pain associated with my use, the likelihood that I'm going to stop using is pretty low. So some of these, programs that we use, like the Smart Recovery, the Rational Recovery, they help, someone who's addicted think about the consequences, think about what's actually happening, and try to identify the part that might just be the, brain damage talking versus reality. Because, for a long time, like I didn't recognize what was going on. My brain was telling me that, yeah, this is what I need to be doing. And I couldn't see the consequences actually happening. And so this just kind of helps us, A, recognize, and then B, how to cope. What are some different mechanisms and ways that I can go about living without it? All right. Okay, this is my last slide. So I've been kind of all over the place, I apologize, but there's definitely some stuff that we can do better. The big one, and I think most people here probably know, is it decriminalize this. The war on drugs has failed. It does not work. Yeah. And this, the more, other countries that we see doing this, watching the success, that they have in actually treating addiction and lessening the harm that it's done, the more I think we realize that it's just, this is something that needs to happen. I don't know how that's going to happen other than continuing with things, like education. A lot of schools, have these awareness programs, like we want to make you aware. And so everyone wear camo today so that you can, drugs can't find you. I'm like, what the F is that? Like, that is not helping anyone. So actually having education, and, kind of like sex education, this is going to be different for everybody, your comfort level about what you should be telling, kids at what age group. But I think, kind of like with sex education, keeping it hidden and not telling them anything does a disservice, because then it becomes a taboo topic, and experimentation happens, and actually and harm happens because they don't know what to expect. They don't understand things like overdoses and what's going to happen if I use, and they end up driving, and just this is where a lot of harm that can be avoidable happens. And then of course my big thing is the acceptance of these non-12-step recovery programs. So I do actually go to AA. And when I first started going, I was just like Al. I was like, what the hell is wrong with you people? But I found a group that's called We Agnostics, and they have a different book that they use. It's the alternative 12 steps. And so basically they've just taken out the higher power thing. Because if somebody had told me to make a tree my higher power, I would have been left. I'm like, this is ridiculous. But there's still, I think, some good stuff that you can get out of these programs. And I think it's a shame to, cut that off. They have, one of the things that I get, that I really enjoy about it is the support network. So we kind of breezed over the sociological stuff, but having a support network and people that you can talk to that can identify and understand, what happened is really a big part of being able to recover. And I'd like, it'd be nice if we had other programs that could do that. So, and then of course there's all this other stuff like safe consumption, and this is where it gets to be really, debatey is, should we be offering clean syringes for people, to use their drugs? Should we be, checking the purity of these drugs? A lot of the deaths that we have are due to fentanyl and carfentanil overdoses. These are opioid medications that are 1,000 times more potent than morphine. So you do just a little bit and you die. And, we don't really have any way to control that right now other than just hope you don't get, that bad batch. They're trying to push things like having naloxone available for people, but that gets into a really, crazy debate as well. All right, so at this point, I'm just going to open it up for questions, comments, things that you, agree with or disagree with. Yes.
Can you de-woo a little bit the psychological aspect of giving your problems to a higher power? Like, what is the psychological benefit of doing that?
So one of the things that, when I talk about that, it's a maladaptive coping mechanism. But one of the things that happens in that cycle between the psychological and the biological is that we don't want to admit that we have a problem. And oftentimes our brains start fooling us into thinking that we don't have a problem and that, we could just stop anytime and, whatever. So the first thing that they do is they talk about, you have to acknowledge that you have a problem. The second thing is, what do we do about it at that point? And so for someone who, believes in God or who has religion, they find strength and hope in their higher power. Psychologically, though, you're basically acknowledging that your brain is not working well. It is telling you to make bad decisions, and I need to listen to somebody else. That's the basis of it. You don't actually have to have a higher power or God telling you what to do. You just have to stop doing the same thing that you've been doing. So, for me, that looked like acknowledging that, my initial instinct is probably not right. I probably don't need to go out and do a bunch of fentanyl. And so, but I didn't need a tree to take that problem from me and give me advice on how not to do that. Is that, yeah.
Well, symbolically, if you're passing on your problems to said tree, then that means that you're passing on your problems to God, whereas the people who are not theists, we don't have that option to pass on our problems to someone else that would be able to take care of our problems. So I think that's probably one of the bigger differences that you would have seen, is that it's just that people who don't believe in a higher power don't have someone there to help them with their recovery. Something I feel like we would have issues with.
Yeah, so the problem is that spirituality has been taken over by, people who equate that with the higher power, with God. And, for those of us who don't subscribe to that thinking, I find meaning and purpose and values, my values in different ways. Like it has nothing to do with, what's right, stated by religion. It has much more to, I'm a secular humanist. So it has much more to do with, my values are based on other humans. And there's different ways to think about it. I mean, accepting that I'm powerless over my, ability to use drugs and alcohol, they compare it to like, there are things that are more powerful than me, Mother Nature, the universe. And so it's just, identifying that like, I don't control everything. And that's kind of, for me, the take home from all of that is that there are some things that I don't have control over. So my ability to use drugs safely is one of those things that I just have to accept.
I'm wondering if the pathways that get developed in your brain that support addiction, are those fairly universal? For example, if you are addicted to nicotine and can't stop smoking, are you very likely to become a very fast drug addict also?
Not necessarily. I mean, they do tend to go together. And so these days, especially we see, with polysubstance use disorder, because those tracks, all of them share dopamine in common. So they all affect that reward pathway. But each drug kind of also has its own subset. So like with opioids, it affects that, endogenous opioid system. And we see a lot of different characteristics, overlapping, but then also, unique to the particular drug. Psychologically, though, I think that's true. I think that if you're using drugs, and so it's the maladaptive, coping mechanism, then, of course, you'd be open to utilizing lots of other drugs, So, I mean, I think certainly from that standpoint, it can be similar.
So you've been through this and know a little bit about it more than other people who are just giving talks on the information itself. What advice would you give for the family and friends who are on the outside of someone experiencing this? What can they do to help or make things better or ease things?
So I think the biggest thing that initially held me back from getting help was the stigma. There's a lot of shame associated with, being an addict. And it was one that I really wasn't prepared to take on. I did not want that label. And so it stopped me from getting help earlier on. So my friends, that were concerned about me, and noticing like, hey, oh my God, you're really having a problem. This is kind of getting out of hand. I'm like, I'm fine. I didn't want to talk about it. I didn't want that to be a problem for myself. So certainly, not normalizing it, but just having an acceptance of, yep, this happens, and it's going to be okay. There are ways, for you to get your life back and for you to get treated. And then, of course, I was lucky. I mean, at the time that I figured out that I had a problem, I knew where to go. So you have a lot of a lot of people who realize that they're addicts, but they don't know what to do at that point. They know that they can't beat it on their own, but they, either don't have insurance or don't know where to go. They don't want to go to their church group or whatever, So there's kind of limited access. So I think, knowing where to, refer people, some places that they can go, and I'll, give resources after this. But there's a lot of really great treatment facilities and places, that you can send friends and family or, have references. I'm trying to think. Oh, and then, the follow-up is that once somebody is in recovery and actually trying, it's hard knowing how to support that person. I had a lot of people who are kind of like, what do I do now? Like, is it okay to drink in front of you? Or, there's just a lot of, and a lot of it is just about having that openness and removing the shame so that you can talk to people about what they need, and because it's going to look different for, everybody. So really just, being willing to talk about it with people, being more open to, finding out what it means for that individual, and then just trying to be as non-judgmental as possible to support whatever it is that they need, to get better.
So getting back to the S, I'm curious if you think that it would help recovering addicts who are secular to either rename the spiritual component. Like, is that something you're advocating for?
So yes, so, and like, the work of Sam Harris, there's a lot of different people trying to kind of reclaim some of this for us, because it really is, it's just an important part of life, developing meaning and purpose. It's like why we're here. And yes, so there's, for some people, just kind of relabeling it helps a great deal. And so not calling it spirituality, but just talking about mindfulness, or we're going to use some meditation techniques, or, we're going to talk about your values and, what you want your life to look like and why you think you're here. Basically it's going to look different for everybody, but any way that you can start bringing that back into conversations with people, I think is helpful.
Yeah, I really wanted to thank you for bringing up this topic. This is an important topic. Personally, a lot of people here already know that I'm in private recovery. I don't participate in any group anymore, but I've been clean for about 6 years. But I did need the groups, and I was in the rooms for a couple of years, and it's very difficult to be a non-believer in AA. They say the Our Father, they say the Serenity Prayer, they call the AA book the big book, but the Bible is the big book. And God is all over that room, and there's an enormous amount of pressure. And I was first exposed to the rooms when I was a teenager, but didn't join because of not being a believer. And I, kind of crawled back in my early 20s, and again, just couldn't accept the steps. And when I finally crawled into the rooms, like in the late 20s, I really could have died many times over that period of time that I was out there. And I have a chip on my shoulder about the fact that there isn't a place for people that need help, and don't believe. And I just wanted to speak out about this, because I want to say that if you know someone who's in the atheist community that's struggling, they're doubly struggling, because they kind of are at a catch-22. The only place to get the best support, you really are kind of, after the big welcoming ceremony the first couple months, you really are put under an enormous amount of pressure to change your beliefs, or essentially you're not going to succeed. You're given that. And so I just encourage people to support and know that, we need the support even more in the atheist community.
Absolutely. Yes. Thank you for sharing that. That's actually, so the clinic that I'm hoping to be able to join, Clean Slate, is a secular-based organization that actually focuses on providing medication-assisted treatment for people who, have addiction to opioids or alcohol. And they want to serve as a kind of a facilitator to point people in the right directions, to make sure that they're getting, adequate psychological help and support, help them build support networks, whatever that may look like for the individual. And that's really what I think treatment needs to focus on is, I'm not saying get rid of, AA or whatever, but certainly it is not for everyone. And there has to be, options for, all different types of people, Buddhists, Muslims, whatever. I mean, those guys also don't do well with the traditional 12-step.
Yeah. Okay. I'm going to try to keep this short, but I'll start out with on October 15th, 1995, I called the suicide hotline. Suicide hotline told me to go to a meeting. I picked up a white key tag at Narcotics Anonymous, and I've never used since then. I am also an atheist, and it is very difficult, but there's a couple of things that I've discovered, and I would love to talk to you afterwards, about the program and different ways to look at the program. And I've sponsored many people in an atheist modality. But two things. One, I want to talk about the tree. because there's actually, when I was really new, there was a guy, I don't know if I'm actually telling this as an anecdote of somebody else that they made up, but I'll pretend like it really happened. But there was a guy coming to the meeting, and he had this tree that he would drive by every day, that he would pray to on the way to work. And so he's doing really well. He's getting about 6 months clean. And all of a sudden, one day, he runs into the meeting in a panic. And everyone's like, what's wrong? What's wrong? And he's like, I'm going to relapse. I'm going to relapse. And I'm like, what happened? He says, they cut down my God. So, but one of the things that this has been very educational and very cerebral. The difficulty that I find in the community is that addiction is generally an emotional problem. We have trouble regulating our emotions, our amygdala, our midbrain, and we can all talk very, very intelligently about it until we're having a feeling, and then it's like, oh yeah, nicotine, caffeine, sugar, heroin, something to change the way that I feel because I'm highly uncomfortable. So, great topic. And I guarantee you, if we talked for years, we could never tell you everything. And she did a great job kind of covering the basics. And I will talk to you afterwards.
Yeah,
if you don't mind.
No, absolutely. I'm so excited, it's amazing, when you kind of come out of the closet that you're an addict, how many people also have, some similar issues. And, it sounds like you're kind of similar to me in that we're pretty strong, highly vocal people. We don't have problems in 12-step programs. I'm like, you can tell me all day long, what you believe, and that's great for you, but I'm going to talk about, my atheism and how this works for me. And so, we just have different ways of dealing with it. But certainly it can be a huge problem for people who aren't as strong-willed.
I know there are a couple of more questions, but we are completely out of time. But I am going to jump the line because and ask about this because I know there's a lot of marijuana users in the group. Where does marijuana fit into this?
I didn't even get to, I forgot the last slide.
I mean, because seriously, because it's becoming legalized in many
Yes.
states.
And so this goes, I can't believe I forgot my last slide, but this is where, a lot of the questions, come up because one of the big, contributors to the opioid crisis is the pain management issue in our country. And so now, they're talking about, is marijuana a safer choice and should it be used? And I think right now the answer is yes. I want to caution people that there's a lot of caveats to this, but we don't often see people develop the addiction that we're used to seeing with strictly marijuana. So we'll leave it at that. Yeah.
All right. Lisa, what's going on with the kids back there? Thank you, Dr. Way. I think that's incredibly brave of you, Megan, to come up before your community and tell such a personal story is very much appreciated. I know there are those here who have gone through similar things and are struggling now. And so I hope it's okay that if we encourage people to just hit your inbox. And so those of you that want to talk about addiction from whether it affects you or someone you love, please reach out to Megan privately.